My name is Daryl Stevenson, and I am the ergonomist at the OHCOW clinic in Hamilton, Ontario. And today I'm going to be talking about what Trevor went over with the apps for knowledge activists and some of the apps that OHCOW's created along with CCOHS over the last few years, and how to use them and how they kind of work to help with health and safety in the workplace. Okay, so here's the apps that I'm going to be going over. The main one that I'm going to be talking about today is going to be painpoint, the one in the middle. It's the most relevant to RSI Day, and we'll be going through a couple scenarios using that. I'm also going to be going over hazard assess, which is a good screening tool for multiple different hazards in the workplace, touching on stress assess, looking at psychosocial factors in the workplace, and then air assess. And all these apps are made for phones, so you can download, and in the App Store, the picture to the bottom left there is what they would look like. So the icons look a bit slightly different than some of the main screens of the apps themselves. So just to start, I wanted to give a big thank you to the CCOHS. They were very instrumental in helping create these apps, and put many hours into these apps and creating them and making them work on phones. And in the words of John O'Dyke, who did a lot for OHCOW on these apps, thank you CCOHS for doing all the work on them. But also big thanks to John O'Dyke, who put a lot of work into these apps, Curtis Vandergrant, who put a lot of work into the painpoint app, which I'll be going over, and Valerie Wolf, who also helped out with the apps. So I'm going to start off by going over kind of what OHCOW does and why these apps were made in the first place, and where they kind of come from. So with OHCOW, we like to look at exposures in the workplace. So what are they being exposed to and how much? And then we like to look at the health symptoms. So what kind of injuries or what different symptoms are coming from these exposures at work? And when we put that all together, ultimately we're trying to figure out, is this work related? Are these exposures causing these symptoms, and are they caused from that work relatedness? So we look back at things like the epidemiology, try to bring in scientific evidence and literature to support the findings that we're finding. And ultimately what we want to do is to prevent these from happening in the workplace. So if we can say, we've seen these exposures, we've seen these symptoms, it is work related, we need to do something about it. How can we prevent this in the workplace? So that's really where these apps were coming from. So just a bit of background with some different levels I'm going to be going over of intervening in the workplace and looking for screening and finding problems. So HAM's vision of the Joint Health and Safety Worker Auditor, there's the worker auditor level, so that investigates and addresses the specific issues and incidents on the floor. Then there's the Joint Health and Safety Audit at the higher level, so policy issues that are in preference over the specifics. Going further, then you can get into the MOL Inspectorate that forms the internal and external audit functions that help monitor the health of the IRS. And in 1990, they gave some more direct responsibility to the health and safety reps and the right to stop work. So looking at a paper from Hall, Forrest, Sears, and Carlin, they looked at the different styles of health and safety representation in the workplace. So looking at knowledge activists and worker representation on joint occupational health and safety committees. So they found that there are two broad forms of health and safety representation. There's a technical legal representation and a politically active. And these were distinguishable by the technical legal group wanting to use more procedures, checklists, and rules to identify the hazards, whereas the politically active group wanted to challenge the claims and constraints imposed by their management. So again, these politically active representatives understood through their behavior that they could improve these conditions in the workplace, and then they needed power and political influence to do so. The technical legal representatives talked a lot about inspections, committee activities, very legalistic terms, and technical. Now from here, looking at the knowledge activists, and these are a part of the politically active representatives. they're a subgroup of that who knows that they need that political engagement, but they're also involved in strategic collection and the use and deployment of knowledge. So these knowledge activists were politically engaged, but they were also seeking knowledge wherever they could to further support their cause. Okay, and what they found was these were the most effective group. They were more effective implementers of change than either the technical, legal, or politically active representatives who did not grasp or mobilize the strategic power of knowledge. Okay, and a further paper was created, again here John Odike contributing, about these three areas. So in looking for new ways to help out joint health and safety committees and workplaces, try to create change at the worker level, they noticed that they were getting bogged down in inspections, meetings, reports, policies, and might have hindered some of the changes that could have been made. There's also new employment relationships, precarious work, an emphasis on reaching young and vulnerable workers, and we needed more ways to motivate action. So they decided they saw, this new technology, just about everyone's starting to have a good smartphone on them almost at all times. So they saw this as an opportunity to get started and to reach more people. And, they feel it just started to scratch the surface with these ideas. So to start, they wanted to look at the levels of hazard identification. So a paper by Melcher out of Belgium discusses these different levels of where hazards can be identified. So to start at the base level, we have the screening level, which accounts for about 60% of the hazard identification. And this is at the level of the worker who's out there and could see these problems arising and then report them. Then about 25% falls into the observation category. So this is more qualitatively organized investigations. So things like checklists that committees can use to go around and collect some information. Okay, and then we further get down to the analysis section with about 12%. And this would be bringing in somebody like myself, an ergonomist, an occupational physician, hygienist, to look at and do an analysis on sort of the deeper problems. And Dave is going to be presenting after on RULA, and that would be something that might fall into this analysis section here. Then the expertise section, about 3%, where they bring in the people much smarter than me, the academics and the experts in the area that come in and solve these very difficult problems. So knowing these levels and how much gets done in each spot, they really wanted to target that screening level. So I place these icons basically where they fall within this level of hazard identification. They were designed for that screening level, for the individual use, for the workers out on the floor who are seeing these problems and can input them and report them. But also, as I'll get into a bit later in the presentation, there are some ways to utilize these apps from a more observation and that committee level, which I'll touch on. But at their base, they were designed for the individual. So looking at the kind of different areas dealing with human factors and ergonomics, we got the physical, and this is the most common that everyone's used to with ergonomics, the physical demands and risk factors, things like force, posture, repetition that lead to the RSI and MSD issues. Then we have the cognitive, so things like memory, reasoning, response, decision-making processes, any stress or frustrations that you have operating anything. And a lot of this cognitive ergonomics was actually put into painpoint from Curtis Vandergraent, who was the ergonomist at the time at OHCOW. And he did a lot with bringing people in, videoing them, going through the software and seeing how they interact with it and what problems they might be having. So that's very much a part of ergonomics. And then organizational, the work organization, the schedule, psychosocial factors, job satisfaction, and overall the culture of work. So I see here the painpoint really aims to collect data on the physical. Hazard assess can kind of span them all and the stress assess is more off toward the more mental side, the psychosocial factors in the workplace. And then air assess falls in kind of its own category, so I kept it out of here. So the hierarchy of controls, they also thought about these, protecting the worker, seeing what they need at the personal protective equipment level, then at the administration and work practice controls, and then even engineering controls. And these apps can really touch on each of these areas, especially hazard assess. So, thinking about how it can affect these was important in creating these apps too. And obviously the most effective way to make change is at that engineering level. So then they wanted to say, so how can we transfer this knowledge? How can we make these apps useful for people and not bog them down in too much information, or just make it useful. So the information is useful in improving workplaces, but it must be applied using all the information possible. And they wanted to gear the information so that it pushed people towards an action. So what do we want the user to do? It's one thing to collect this information, but then where do you go from there? If you're not creating change, there's really no point in collecting information. And that's a good point for anyone going to use these apps in the future. If you're going to be collecting information, it's important to act on it, especially in a workplace. If you're having workers collect information, you don't want them to collect it thinking that, oh, I'm going to make a change, and then not have any response to it. It's going to lose some trust there. They also wanted to keep the information in kind of bite-sized elements, so maybe 5 steps to lifting safer, and a lot of the suggestions have 3 general guide suggestions printed off for them. So keeping it simple, but then, for those knowledge activists, going back to that, how do we feed the hungry knowledge activists more knowledge, more information? We put information in there in the appendices for the curious. So there's links to websites, there's links to additional information, and lots of it. And I'll go through that as we go. Then they wanted to use a pattern doing something about the specific hazard. So doing something about repetitiveness in the workplace, or doing something about heavy forces. And really trying to start from that, we're doing this to make a change. Okay, you also want to make it fun and simple, and realizing that if all you have is a hammer, then everything you see is a nail. The tool defines the problem and the solution. So not forcing them into the same solutions every time, but being general enough that you're not always doing the same thing as a solution. Okay, and then working on crowdsourcing, and something like today, me coming here and talking about the apps in a workplace, maybe setting up one day a year where you're going to assess for hazards or assess for pain, similar to the April 26th International Noise Assessment Day, where everyone assesses noise in the workplace. So what did they want to bring into these apps, and what were they already doing is the questions they were asking when designing these. So things that they're already doing in the workplace, using tools, using surveys, assessing for exposures. How do we turn these into an app and get them to more people? And then how do we design tools which embody a pattern of action? Again, creating that action and making sure it's just not taking information and not doing anything with it. So for the painpoint app, which I'm going to be going over now, the basis for this was MSD surveys that they used to use in workplaces. And these surveys were based off the Marley and Kumar an improved musculoskeletal discomfort assessment tool paper. And basically they came in 2 parts. So there was a body map that was sent out to workplaces, and all the workers could input in each section their pain and the frequency that they have that pain. And there was a little box for each body part. There's about 20 boxes. And they would go through, input that, and what that would do, and I'll show you on the next slide, there's a chart. Let's go to it. So on the left there, you have the discomfort. So say they were a 5 discomfort, and they were frequently experiencing this 5 discomfort, then they would be at a 2. And that correlates to somewhat likely to seek treatment. So these areas were about if they will seek treatment, and that's kind of how that worked. Then there was exposure questions. And these led to suggestions on how to reduce these exposures. So for these exposure questions, they would tailor these questions towards each workplace. So looking at the left, you might ask some questions in an office, like, are you looking at the level at the screen? How's your wrist posture? Things like that. Whereas in industrial work, we might have more things like, are you pushing and pulling? What type of grip are you using? Are you standing all day? Are you lifting? So that was how that worked. They would collect information on the pain in the workplace, on the exposures in the workplace, and then put that together in a report for each business. So that, because of OHCOW, there are 6 ergonomists in all of Ontario for OHCOW. So we cover all of Ontario with 6 of us. So there's not the ability to go into every workplace, collect all that information, run all that, and give that back to every workplace. So from there, they created a spreadsheet in Excel that was able to be shared with whoever, different companies. And you could put an entire workplace into these spreadsheets by group. And what they would do is the same idea as the previous surveys, that you put all the pain in and then the exposures, and you could change the exposure questions to tailor again for each business. And these spreadsheets would then generate a bunch of really interesting graphs and data that would be nice reports for the workplace. And this is still available on our website, and workplaces can still use these, and they're very useful. However, again, that was still a lot of work, and it still wasn't always reaching, that screening level in the workplace, that front level. So this is where, they decided to create painpoint and use that information that they've already been doing, but put it in a more accessible format. So this was released in 2015, again, between CCOHS and occupational health clinics for Ontario workers, working together, creating this app. So this app was intended for individual use, which I've stressed on. What it can do is basically combines what we were just going over with the survey, with the pain and the exposure questions. So combining the work-related pain and the exposure questions, desire to raise awareness about the work-related pain and how to take action to prevent it. So it really leads people into suggestions and an action. And then it recommends steps the user can take to reduce their workplace exposures. Okay, at its base function, it delivers a very basic ergonomic assessment. The results are then depicted onto a body map. It gives these recommendations to try to fix some of these issues. With each of the hazards and with each of the pain points, it will give a summary at the end, and it will give 3 general recommendations to fix that hazard. Then a summary of results can be shared, and the history of results can be stored, and they're stored on the individual's phone. And from there, they're stored in a PDF format, and they can be shared. And I'll go over that right at the end of this pain point. So it's a good first step for recognition, action, and prevention. So here's what it looks like on the phone app on the left, if you want to install it, off our website, and then off the CCOHS website. Once you get into the phone, I put this more information up just because I wanted to show the survey app does not collect or disseminate any of your personal information. Again, this was really designed so that it wasn't for committees to collect information and bring all this information in from individuals. It was for the individual themselves to empower themselves to learn more and to seek action, but it was all confidential and kept within their own device. On the right, we have the start, what you'd see at the start. So we're going to get started and kind of walk through what you'll see going through this app. And the rest of the apps, I'll show them a little bit, but they're all set up the same way. So when we get into the app, what you're going to see is on the left, we see different regions. So neck and back, right arm, left arm. And this was done because there's so many points to input for your muscles, going back to those spreadsheets where there's so many boxes to input. And not everyone has a big enough phone or small enough fingers like me to click on each of those little points on the body. So if you click into each of those neck and back, it'll bring you into a bigger screen with more options. And we'll see that on the next screen here. So we click into that right arm section. And on the left here, we can see we got right upper arm, right elbow, right forearm, right wrist, and right hand. And I walked through this first one thinking about an office worker and what they might be clicking. So maybe they're right-handed, they've been using a lot of mousing, the right elbow, maybe they're leaning on it all the time, whatever it is, they got some right elbow pain. So they're going to put that, they're going to click the intensity at the top there. So they got a 5, which is moderate discomfort. And then the frequency is rarely. So a few times a month, they feel that pain. Okay, after they input all their pain points, so they'll go through and maybe they'll have some neck pain or lower back pain, they'll input that, then it'll bring you to these exposure questions. And a lot like the exposure questions created for those surveys, we want them to cover as much of the workplace as possible. But because now we're not tailoring these each to an individual workplace, they had to be made a bit more general. So there is lots of them within there that might not apply to all workplaces, but that's fine because you can just click never and then move on. So it's more about identifying the hazards. So they are very general in that sense, but they do cover a lot of areas. So we can see here for an office worker, they sit for long periods of time often. They're using a keyboard or mouse intensively often. They're performing repetitive movements of the arm or wrist or hand often, things like that. So you go through and click each one. Then at the end, what you're going to get is the results. So this is the body map that you'll see. So as we can see here, the colors correlate with the severity of the pain. And again, that leads to will they seek treatment? That's where that was based off. So the lower back, the elbow, both have the low, unlikely to seek treatment, but there is some pain there. And then the neck has the severe pain. So maybe there's something going on with their monitor height or something like that. So having that neck pain in the summary, and then there's some general recommendations for the pain that are attached to each of these. Okay, then we get into, when you go to the next screen, it'll break down all those different areas. So the neck strain, it'll give you the top 3 suggestions for that. The keyboard and mousing, things like use voice controlled technology, use keyboard shortcuts and keys, alternate with hand-free tasks or take breaks. So some general suggestions within each of there. And again, it might not cover everything, but we wanted to give the top 3 suggestions. And from there, you can go off and find more information. So the history gets saved right on the phone as soon as you're done. And it looks like this in the history, and you can bring up your past results, look through what you've been doing, when you did it. And then you can also send those results pretty much anywhere you want. So you can send them as an email, and it'll come up and look in your email like it does to the right here. So you'll go through and you can see, okay, I have a pain level of 3 here, pain level of 3 here, intensity 6. And then it talks about all your exposures and gives all the recommendations for each of those exposures. So you can keep these documents, check them over time, or send them anywhere that you want. Then there's an action plan. Again, trying to lead people to action. So taking action to help prevent MSDs at work, things like how to learn more, how to get organized, how to assess, how to try to make that change, and then how to evaluate that change. So a lot of leads to help people take action. So I did some mock work here. Actually, I took a dental hygienist, as my wife's a dental hygienist, and I had her fill out the painpoint app and go through it. And just to show you basically what some outcomes might look like. And then on the right here, I had Andrew Flanagan, the ergonomist who presented on carpentry on last Thursday, go through and fill out as what he was feeling as a carpenter and he used to work there. So the dental hygienist, we see a lot of pain in that, her left arm. She's left-handed and does all her scaling with that arm. Her neck is in pain a lot. So you can definitely see some trends and see, what's going on. And what I found really interesting, actually, is that as she was doing it, I tried to do the painpoint app on my phone and see how it compared what I would know based off her work. And I'm an ergonomist. I've done presentations on dental hygienist work. My wife's a dental hygienist. We talk a lot about it. And I still didn't find everything that she would have put down. So things like lifting and carrying, I had at never. But she said, no, we're bringing in stock a lot. And I put keyboarding at never. And she said, no, we got to keep going back and forth to the keyboard every time we're doing things. We're inputting stuff for the patients, we're inputting files. So little things like that, you're going to find, pop up. And that's why it's important, again, to always go to the workers, the people doing the jobs themselves are always going to have the most information about it. Every time I do an ergonomic assessment, I try to get the workers' input as much as possible. They're the ones that, live this and they think about this job a lot. A lot of times they have great suggestions, and they maybe just didn't have the power or knowledge to put it in place. But, they have the best answer. So again, having them do this is very important. Then we can see on the carpenter, he's got problems with his hands, probably the right arm there, the dominant hand with the tool. He's got more problems up the forearm, neck, back, and lower back. So just a summary of painpoint. So individuals can download and use the app screen for pain and hazards and follow the recommendations and action plan. This can be done over time. So you could schedule, every couple months or once a year, take these assessments and see what's going on with the individuals in these jobs or with yourself. And that is the main way it was designed, for yourself to keep track and to improve your own situation. And while it's intended for that individual level, the results can be shared in multiple ways, including email, PDF, and text. And, it can be shared in even more ways. So your phone saves these files as a PDF, but you can also just share all. So you can send the information, just like I showed earlier in the text, to an email. You can even text it. So I put share on my phone and then sent it to my mobile number, and it sent a text of all the information. And I sent the same thing to my wife on WhatsApp, and it sent it to her that way. So there is, very kind of unlimited ways to share it now because it uses the mobile sharing. Then unlimited assessments can be done on the same device. And I put this in there because this is kind of where it crosses over back to that observation level of screening, where, you could have one person go around and take an assessment. As long as everybody was okay with it, one person could use one phone and take an assessment of each of the workers on the same job or different jobs, and then bring that together. It doesn't combine the data like it did for the surveys, but you could still look at it and find trends and compare it. So I'm going to talk about the Hazard Assess app now, and it's an app for reporting workplace hazards. So basically what Hazard Assess is, it runs through a checklist of 12 different categories of hazards, and it rates them on a scale. Are you concerned? Are you annoyed? Does this interfere with your work? It also asks to report if the exposure-related symptoms, the source of the hazard, and then it allows the person to actually input suggestions for changing. So again, I really like this Hazard Assess as an initial screening tool because it allows for those suggestions. It allows for pictures to be entered. You can draw on the pictures and really show what the exact problem is. Okay, and then same way as painpoint, the results can be emailed and shared in any similar fashion. So looking at these 12 different areas, what are the workers worried about and what are we looking for with these hazards? So things like ergonomics, MSD issues, lifting, etc., noise, lighting, unsafe conditions or accident hazards. One big one, often a top issue, is the workplace stress and psychosocial factors, air quality, thermal discomfort, working alone, driving hazards, and then some biological and chemical exposures. So a lot of different areas that it can screen for. So as you go into the app, once you get started, you'll see a picture like you do on the left here. And then you can just go through and say, okay, this is what I'm screening for. So what I did is I clicked ergonomics. That's the topic today. So workstation design, layout, furniture, tools, lifting, pushing, pulling. It just gives you some general what it's going to be about. Then you go into that and here's the next screen where you'll input, again, that sliding scale of it's well designed or controlled, or exposures interfere with the ability to get the job done. So what they can do is place the exposure details in that first box. They can talk about if if the exposure causes them any symptoms in the next box, they can take a picture and then they can suggest possible solutions. Okay, and then like the other apps, it does give some general suggestions on how to make some change in these, some recommendations, but also it refers you now to the painpoint. And if if there's further ergonomic issues, maybe try painpoint as the next step. You'll get a summary, as you can see to the right, and these color-coded areas match up with how you coded them as you were going through assessing them. So it gives you kind of a summary, and all the apps do that, give you kind of a color-coded summary as a visual. Okay, so just looking at, here's an example. This is John Odike, and this is actually his office back in our old office in Hamilton. Just looking at safety hazards within his office. So with his office, he said, there's too much clutter. My piles keep falling. I'm worried about getting injured. And he took a picture of it and said, go paperless is his suggestion. And those piles could have fallen on him at some point. So then this is just to show that you can draw on the pictures and you can really highlight what the exact issues is. So these just looking at chemical ones, but just to show that you can really circle in and show the exact problem. That's what I really like about this app when learning about it, is that it's very direct and it's a very good screening level app. Okay, then again, you generate the PDF of your results and share them. And this is how it'll look. You'll get PDFs that are single sheets based on the area of concern. So for this one, the chemical, you'll get a sheet of hazard assessment. But if you did all 12, you'd get 12 sheets or PDF sheets in a row that each have their own picture, solution, and problems laid out. So you could sort them out that way too. Okay, and then again, for those knowledge activists, for the people wanting more information, there's additional resources at the end. And when you click into those resources, so if on the left screen there, number 5, ergonomics, I'll click on that and it'll go right to the CCOHS website that has ergonomics and has lots and lots of different topics on ergonomics. And there's links to our website as well with OHCOW. Same idea. If you want to learn more, there's lots more on those websites and it'll lead you right to there. Okay, and then I want to talk a little bit about Stress Assess. So Stress Assess is a survey of the psychosocial factors in your workplace. Okay, and it's based on the Copenhagen Psychosocial Questionnaire, COPSOC. It's actually based on COPSOC 3 right now and customized to address concerns with the Canadian workplace. So just quickly, I won't go through all of this, but some psychosocial factors in relation to MSDs in the workplace. Things, this sickness absence from back pain from 1997 showed just not feeling valued or not having the ability to change a workstation had an odds ratio of 1.95. So 95% increased risk of claiming an MSD as work-related, just based off answering no to those 2 questions. So not feeling valued or the ability to make change. And if you notice, these apps really speak to that. It gives some power to the person to say, look, I'm assessing this. My input matters, and this could create change. So again, if you're going to do these assessments, think about how am I going to make change with this, and because that is the end goal, and that will change some of those feelings. Okay, the psychosocial work environment represents a potentially reversible cause of ill health. In a systematic review and meta-analysis, improving the psychosocial work environment might have an impact on reducing MSDs. Okay, they found there's association between MSD and hospital nurses, nursing aides with psychosocial risk factors. And psychosocial factors and depression are significant predictors of MSD among teachers in another big study. So there's 2 different versions to choose from. The personal edition is the one on the phone, and I'll be going through that. But there's a workplace edition, and that measures the entire workplace. And that is the bigger one that is used a lot. The personal edition's still used a lot, but the workplace edition also gives personal feedback and the individual reports back. But for people that want to just do it for themselves or in a smaller group, the personal edition can work just fine. just very similar to the apps I've been going over. So here's what the app will look like. Sorry, that looks a little blurry there to the left. But you're going to go through and answer a number of different questions. I think there's 45 questions within this, and it'll summarize the results for you at the end and lay them out in these different areas of the psychosocial factors that COPSOC covers. So here you can see at the end, you'll see the work demands, the work organization, and again, these arrows are going to correlate to if there's a problem or not. So maybe they're having an issue with work demands, and you can see the quantitative work demands they've signaled as being an issue. So you go through and collect this, and then it gives you a lot of ideas for reducing these things like work demands. And Stress Assess definitely has a lot of good suggestions, and it's very thorough in its suggestions and recommendations. Okay, and then also, if you want to go further, just like with our website, they have the mental injury toolkit, and again, that's just more information for those knowledge activists to go to and deal with some of these issues that they're seeing on the Stress Assess. So I'll just quickly go over Air Assess. There is some crossover with Air Assess to Ergonomics even. It has some issues with dealing with noise and lighting and thermal comfort and things that might affect how people work and function throughout the day. So it is a great tool to assess the air. I know, speaking from John, he says that you don't really notice air problems until you start to see some symptoms, until you start to see things like people feeling not as good in the workplace, or coughing more, or feeling tired. Those symptoms start to come up, and then this is a good way to check, okay, maybe there's something going on with the air before bringing in a big expensive assessment. You can try to collect some data from the workplace using this. So very similar. All these apps are designed the same, that you're going to go through, get the recommendations, get the action plan, and the ability to share that information. So here's kind of an overall chart that I made to try to summarize how you could put these together and where they might work. And this, you can do these a number of different ways, and doesn't have to start with this hazard assess or anything like that. But here's just an idea of how to use it. So starting with hazard assess, you could assess for hazards in the workplace. And then from there, it might say, okay, we've identified you have ergonomic issues. Okay, so from there we can say, well, we can assess for pain and exposures using painpoint. Take those recommendations, try to implement those changes. If that doesn't work, then we can go for something like an ergonomic assessment and reach those next levels of hazard identification. Then maybe you find psychosocial factors in the workplace. And if you do, then you could run stress assess and assess for the psychosocial factors. Okay, you try to implement those changes. If that's not enough, you can bring in outside support, or you could do the workplace stress assess, where someone like John Odike or somebody from OHCOW will help facilitate the stress assess. Maybe you have air quality concerns, you can run air assess, same idea. But then if you have things that are identified that are other hazards, or you want more information on these ergonomic hazards or psychosocial factors, then you can get linked to the OHCOW CCOHS websites and go through there, and both of those have tons and tons of information and hundreds of videos and presentations to learn more. Okay, and that basically summarizes it. The 4 apps. There was planned to be a 5th app, the heat stress app, but they're very useful apps, and the more that I've found working with them, the more useful I've found them to be, and I really think that they're, if everybody used it in Ontario, there would be a lot of changes made, and workers would be better off. So if you have any questions, please email me or painpoint@OHCOW. Thanks.
Great, thanks, Daryl. If there's any questions for Daryl, please put it in the chat. Daryl, there is one. The slides related to the research on Joint Health and Safety Committee styles. Can the links of those papers be provided?
Yep, they will for sure. And I think it's the Hall paper, and it is linked on that slide itself, but I can definitely share that if it's not.
And what we can also do,
Yes.
Daryl, if you want to send it to me, I can include it with the recordings that will be going on our YouTube channel as well.
Okay.
So it'll be embedded right in there. Another question is, are there in-app purchases?
In-app purchases? No, not that no. OHCOW is free.
Yep.
So it's, yeah.
Next one is the app validated?
Yeah, so they used, like the survey was validated. The app itself, I'm not sure, but they used the exposure information was from researchers from Washington State, and I believe CREMSD was using those exposures for some things back then. And the pain questions were from the Marley and Kumar paper. So they are, and then the stress assess, the COPSOC is definitely validated. That's a big one, and a big community of researchers that keep improving that stress assess.
Okay, well, Daryl, thank you very much.